So welcome to Angel Health Academy. Topic for the day is levels of prevention. LOP, levels of prevention. Levels of prevention is one of the important topic in community health nursing. It can be applied in for the prevention of communicable disease and prevention of the non-communicable disease. And this topic even it starts with the first semester foundation of nursing. We have levels of prevention. Then fifth semester community health nursing first having the topic of levels of prevention, and even for School of Nursing students, GNM programs, community health nursing, and B.Sc and MSc programs, we have most important short note or essay is levels of prevention. So let us talk about levels of prevention. So let us introduce the topic. So actually the goal of medicine at present, when the health is impaired, when there is a problem, that is goal of medicine is to promote the health, to preserve the health of that particular person, to restore or maintain the health of the person, to minimize that particular suffering and distress related to due to from various diseases. So the goal of the medicine is to promotion of health, preservation of health, and restoration or maintenance of health. So these goals are completely involved or included in the word of prevention, or it comes under the word of prevention. The promotion, preservation, and restoration of health. Thus, prevention or levels of prevention is the key element of community health or community health nursing to promote the health, to protect the health, to restore and maintain the health of the individual, family, and community. So it is the one of the most integral part or emphasis in community health nursing is prevention. So prevention is, it is a key element of community health or community health nursing to promote the health, to protect the health, to restore and maintain the health of both the individual and family, thus the health of the community. Next is definition of prevention. The definition for prevention is actions aimed at eradicating, eliminating, or minimizing the impact of a disease and disability, or if none of these are feasible, possible, retarding the progress, so reducing the progress of the disease and disability. So it is a group of actions, a set of actions aimed at eradicating, eliminating, or minimizing, reducing the impact of disease, the progress of disease, impact of disease and disability, the impact of both the disease and disability, or if none of these are feasible or possible, retarding the progress, so reducing the progress of the disease or progress of the disability. So this is the definition for prevention. Next is the concept of preventions. So traditionally we have three levels of prevention, that is primary, secondary, and tertiary. So traditionally we have three levels of prevention, that is primary, secondary, and tertiary. Later a fourth level of prevention also implemented or launched, that is called primordial prevention. So later in levels of prevention it was added, that is primordial prevention. So traditionally we have three levels of prevention, primary, secondary, tertiary. Then later we have added to prevent the non-communicable diseases, that is primordial prevention. So now let us talk about the Leavell's levels of prevention. So this levels of prevention is explained by or introduced by the Leavell's. So let us talk the levels of prevention according to Leavell's. So according to Leavell's, there are four levels of prevention, that is primordial prevention, primary prevention, secondary prevention, and tertiary preventions. So according to Leavell's levels of prevention, we have four levels of prevention. That is, first one is A stands for primordial prevention, second one is B, primary prevention, third one is C, that is secondary prevention, and last one is, that is D, tertiary prevention. So let us talk in detail about primordial, primary, secondary, and tertiary preventions. So before we go to in detail about levels of prevention, let us have a summary of that levels of prevention, and we have a schematic presentation or diagrammatic presentation of levels of prevention. So levels of prevention, actually it is used for both prevention of communicable diseases and non-communicable diseases. So we said later we have added one primordial prevention, that is mainly focused on prevention of non-communicable diseases. So levels of prevention, first it is divided into non-communicable diseases and communicable diseases. So we start the traditional levels of prevention, that is primary, secondary, and tertiary, that is usually used for communicable disease prevention. At the same time, non-communicable diseases also can be prevented through application of primordial prevention, secondary prevention, and tertiary prevention. So we have two sides. One side is non-communicable diseases and another side is communicable diseases. So for the prevention of communicable diseases, we apply primary preventions. So you can see here all the preventions as two interventions, specific interventions. So that is a one clue for you. So primary prevention we have two interventions. Primordial prevention have two interventions. Secondary prevention we have two interventions, and tertiary prevention also have two interventions. So now you can understand each levels of prevention consist two specific interventions. Okay. So primary preventions have two specific interventions, that is health promotion and specific protections. Then primordial prevention also has two intervention, that is individual education and mass education. Mass education means group education. So then when we fail the primary prevention or primordial prevention, we'll go for the secondary prevention. So primary prevention and primordial prevention usually we apply in the pre-pathogenesis stages of the diseases, that is before the occurrence of the interaction between agent, host, environment, or before the onset of the symptom, that is called pre-pathogenesis of the disease under natural history of disease. Then once the primary and primordial prevention is failed for both prevention of non-communicable diseases and communicable diseases, again we can retard the progress of the disease, that is through secondary prevention, that is early detection and adequate treatment. The two specific interventions are early detection and adequate treatment in secondary preventions. Here disease is already started, okay, manifested. So we as early possible we detect, we rule out the particular problem. So early detection, then followed by adequate treatment, complete course of treatment. Then when we fail in the secondary prevention during pathogenesis phase of the natural history of disease, we go for the next to prevent the complication of that particular disease or disability, we apply for tertiary prevention. That includes two specific interventions, that is disability limitation and rehabilitations. Now let us discuss in detail about all these four levels of prevention. So first is primordial prevention. So primordial prevention consists of actions and measures, a lot of actions, a set of actions and various measures that inhibit, that reduce the emergence of the risk factors in the form of environmental, economic, social, behavioral and cultural risk factors. So for every disease, every disability, there is many risk factors. So that may be environmental risk factors, economic risk factors, social risk factors, behavioral risk factors and even cultural risk factors. These all the risk factors has to be inhibit, has to be reduced. So emergence of entry of this risk factor, this type of risk factors has to be inhibited by primordial prevention. That includes a number of measures or set actions. So it is nothing but primordial prevention consists of actions and measures that inhibit the emergence of risk factors such as environmental risk factors, economic, social, behavioral and cultural risk factors, etc. Thus the primordial prevention is the prevention of the emergence or development of risk factors in the countries or in the population or in the family or in the population group in which they have not yet appeared. So here application of primordial prevention is before the entry of the particular emergence of risk factors. So that means in which they have not yet appeared, but that may appear in the future or in the early future, that has to be prevented. So primordial prevention is the primordial prevention is the prevention of the emergence or development of the risk factor that is not yet appeared but that may appear in the future. So before that we try to prevent. That's what we call it is a primordial prevention, to prevent the non-communicable diseases especially. For example, many adult health problem, example obesity, hypertension, diabetes, etc. These are the non-communicable diseases, have their early origins in the childhood. Actually, it is originated from childhood, but it manifests in the adult period, later in the adult stage. Because this is the time when lifestyles are formed. So our lifestyles, habits, etc. formed in the childhood. So it has to be corrected and modified in the childhood. Then we can prevent such non-communicable disease problems such as obesity, hypertension, diabetes, etc. in the future when that particular client or person become adult. So for example, that the behavioral lifestyle modification or lifestyle change, that is starting smoking, alcoholism, eating patterns, difference in eating patterns, okay, then physical exercise, lack of physical exercise or developing regular physical exercise, all as the part of the lifestyle that will be developed, that may be developed in the early childhood. So thus in future these are the factors which influence the number of origin of the or starting of the non-communicable diseases. Thus, in primordial prevention, efforts are directed towards discouraging the children from adopting the harmful lifestyles or bad habits, and at the same time enhancing or promoting the good or sound habits and lifestyles in the childhood period. So, in primordial prevention, efforts are directed towards discouraging the children from adopting the harmful lifestyles and bad habits, then promoting or enhancing or developing the child to continue the healthy lifestyles and good habits development. The main specific interventions of primordial prevention is, one is individual education, another one is mass education. We have already said that there are two specific intervention in all 4 levels of prevention. So, under primordial prevention, the two specific interventions are, one is individual education and second one is mass education. So, individual education includes a promotion of healthy behavior or sound habit formation in the early childhood. For example, promotion of regular exercise pattern, promotion of having balanced diet, adequate calories intake, adequate rest, adequate sleep, and practices of any personal hygiene, environmental hygiene, etc. to prevent the diseases. So, this all comes under the topic of individual education. Then in mass education means educating a group, all the individuals. That is huge gathering of children. That is discouraging the children from adopting harmful lifestyles such as weight reduction, avoid smoking, alcohol and substance abuses, etc. to prevent the diseases. The second levels of prevention is primary prevention, mainly applied to prevention of communicable diseases. Okay, what is primary prevention? Definition of primary prevention is, primary prevention can be defined as the actions taken prior to the onset of disease. We already said it comes under in the phase of the pre-pathogenesis phase of the natural history of disease. So that is action taken before the onset, before the manifestation of the signs and symptoms of a particular disease, that which removes the possibility that this disease or that disease will ever occur in the future. So if you have taken action prior to the onset of disease, that disease never occurred. That may not occur in the future or later. So which removes the possibility that the disease will ever occur. So primary prevention is the action taken prior to the onset of disease which remove the possibility that the disease will ever occur in the future. So thus primary prevention includes the concept of positive health, having a positive health. The positive health is nothing but it is an acceptable level of health that will enable every individual to lead a socially and economically productive life. So you may be remember that this is the definition also we are used for the health for all by 2020. So positive health is nothing but having an acceptable standard of health or level of health that will enable that particular individual to lead socially, economically productive life throughout. Thus, primary prevention is applied in the pre-pathogenesis phase of the disease, before the occurrence or manifestation of the signs and symptoms, before the interaction of agent-host environment. The two specific interventions under primary prevention is, one is health promotion and second one is specific protections. Health promotion is an important topic you can study. I am just connecting the content related to levels of prevention. So health promotion and specific protection. Let us see what is health promotion and specific protections. So first one is health promotion. Health promotion is the process of enabling people or individual to increase the control over the determinants of health. Determinants is nothing but factors influencing health. We are already studied determinants of health in one another topic. So there are many factors which influence the health of a particular individual. Okay. So control over the determinants of health and thereby improve their health or they become positive health. Improve their health or maintain socially, economically productive life. So health promotion is the process of enabling, helping the individual or helping the people to increase the control over their determinants of health or factors influencing their health, and thereby they have improved their health or they may have a positive health. So the measures include under health promotion is health education, environmental modification, nutritional interventions, that is having balanced diet, lifestyle modification or behavioral changes. All what we have discussed in the primordial prevention also comes in this primary prevention. Health education, okay, environmental modification, nutritional interventions, then lifestyle and behavioral changes, and developing sound habit or good habit in this period, okay, to prevent the particular diseases and other health related problems. Next is specific protections. So specific protection also can be given to the individual during this pre-pathogenesis period to prevent the further occurrence of the diseases such as immunization. So the measures under specific protections are immunization, chemoprophylaxis against a particular disease to prevent the occurrence, then use of specific nutrients and supplements, for example vitamin A supplements etc. to prevent the vitamin A deficiencies, then safety of drugs and foods, okay, safety of having good drugs and good foods, okay, that food hygiene etc. Then control over the environmental hazard to prevent the pollution of the air, water, soil etc. So control of the environmental hazards. So this all comes under the factors that comes under specific protection in the primary prevention as a measures. So in short, primary prevention, there are two specific intervention, health promotion and specific protection. Health promotion includes health education, environmental modification, nutritional interventions, lifestyle and behavioral changes. Specific protection includes immunization and seroprophylaxis to improve the immunity to prevent the particular disease, chemoprophylaxis to prevent the particular diseases, use of specific nutrients and supplements to prevent the nutritional deficiencies, then protection against occupational hazards by having PP kit or other things. So protection against occupational hazards in the factory or industry or against the occupational diseases. Then safety of drugs and food hygiene, control over the environmental hazard to prevent air, water, soil pollution. So this all comes under the measures under health promotion and specific protection under primary prevention. So next is the approaches of primary prevention. As per World Health Organization, or World Health Organization has recommended the following approaches for primary prevention of the chronic diseases. So we can use primary prevention even for chronic diseases, as WHO recommended two measures, like one is population strategy and second one is high risk strategy. So these are the two important approaches of primary prevention according to WHO recommendations. So first one is population or mass strategy. Population strategy is directed at the whole population, total population, irrespective of individual the risk levels. We are not bothering about whether the individual are risky, and we are not bothering a particular only that individual. We take all the population, whole population, and we apply the population strategy. For example, the research studies shown that even a small reduction in the average blood pressure and serum cholesterol of a group of population would result a large reduction, okay, decreases in the incidence of occurrence of various cardiovascular diseases. That is the importance of significance of having application of the population strategy. So the population approach is also directed towards socio-economic, behavioral and lifestyle changes. So strategy will be applied towards socio-economic, behavioral and lifestyle changes of the whole population. The second is the high risk strategy. The high risk strategy aims to bring preventive care to the individual at special risk. So in this measure, the high risk strategy aims to bring preventive care to individual at special risk or high risk. So those who are having family history of any non-communicable diseases or any other diseases, we will select those people and give special measures to prevent the occurrence of diseases. So we use all the available clinical methods here to find out or to detect the individuals who are at risk or special risk or high risk, and we make a special focus or special attentions and with various care and measures, thus we prevent the diseases. So that comes under high risk strategies. So in this we focus only the high risk people or people with or individual at special risk. So this is the second recommendation given by the WHO as the approaches in primary prevention. The third levels of prevention is secondary prevention. When primary prevention fails, we go for the secondary prevention. Let us see what is the meaning of secondary prevention. So the definition of secondary preventions. It is defined as, it is the action which halt means reduce the progress of a disease. So it is a set of actions, a group of actions which reduce the progress of a particular disease at its incipient stage. Incipient stage is the first stage or the beginning stage of a particular disease and prevents the further complications. So secondary prevention defined as action which halts the progress of a disease at its incipient stage, in the beginning stage, and prevent the complications. So further complications can be prevented. So this is the definition for the secondary prevention. The secondary prevention attempt to arrest the disease process. So here we stop the process of the disease from first stage to second stage. Then restore health by seeking out unrecognized diseases. So we restore the health of the individual by seeking out, finding out the unrecognized various problems and treating the problems before it become irreversible pathological changes takes place. So we treat the such diseases before the irreversible. That is, irreversible means we cannot change in the later. Irreversible pathological changes, physiological and pathological changes which takes place due to the occurrence of a disease, and we reverse the communicability of the infectious diseases. If it is a communicable disease, the communicability that is transferring from one person to other person will be reduced, will be reversed, will be solved or arrested. Okay. It thus protect others from in the community from acquiring the infection. Thus, we can prevent the other people to get the infection from those infected people, and thus provide at once secondary prevention for the infected ones and primary prevention for their potential contacts. So, actually, we are applying the secondary prevention in the second phase of the natural history of disease, that is pathogenesis phase. Here, interaction is occurred, manifestation occurred, and the person is suffering from particular problem. So, those people will get the secondary prevention. That means once secondary prevention for the infected people, and primary prevention usually we apply for the in the pre-pathogen phases. That is, those who are may be contacted from these people, that is secondary preventive measures applied people to primary people, that is their potential contacts. Thus provide at once secondary prevention for the infected people or infected ones and primary prevention for the non-infected people or for their potential contact. The specific interventions, as we are already mentioned, there are two specific interventions. Two specific interventions are the early diagnosis and adequate treatment. So early detection of the cases from the community and giving maximum adequate complete course of the treatment. So first one is early diagnosis or early detections. That means usually we do mass screening test in the community to identify all the people who are suffering for a particular problem. That is early detection. That is, we can also call it as it is the case finding program. So we are finding the cases from the community by doing mass screening test. Then after that, after finding out the case, we go for the adequate treatment. That is, we give the specific drug for the particular problem with the complete course of the treatment. So for example, antibiotic we are giving 6 days treatment, some antibiotic we have 5 days treatment. That is a complete course of the treatment that prevent the resistance of the bacteria. So the adequate treatment is the specific treatment with the complete course of the treatment. Thus, we prevent the spreading of the infection from the secondary people to the primary people. Last levels of prevention is tertiary prevention. If we are failed in primary prevention and secondary prevention, the last course of prevention is tertiary prevention. Thus, tertiary prevention is used when the disease process has advanced beyond its early stages. So, in secondary prevention, we are preventing in the incipient stage, early stages. Now, incipient stage is over. Now, they become that later stage. So, during the later stage also, we apply the levels of prevention that is called tertiary prevention. Thus, it is used when the disease process has advanced beyond its early stages. The definition for tertiary prevention is all the measures available to reduce or limit the impairments and disabilities that is occur due to a particular disease. So, all the measures available to reduce or limit, cut short, impairments and disabilities, thus to promote, that is, and to promote the patient's adjustment to irremediable conditions, without remedy, without treatment conditions, patient has to adjust. So, all the measures available to reduce or limit the impairments and disabilities which occurs due to a disease and to promote the patient's adjustment. Patient has to adjust with the irremediable condition. So, in later cases, we cannot treat the patient well. So, patient has to be adjusted with the condition of without treatment, that cases. Okay. So, that is comes under tertiary prevention. So, there are two specific interventions under tertiary prevention also. That is disability limitation and rehabilitation. One is disability limitation and another one is rehabilitation. The tertiary prevention also we applied, this intervention we are applied in the process of in the stages of pathogenesis of the disease or health problem. So, the first specific intervention is the disability limitations. So, usually a disease, if it is not treated well, if it is not prevented by levels of prevention, that may lead to impairment, and impairment may lead to disability, and disability may lead to finally or ultimately as handicap. So here the intervention is made, that is disability limitation of the disability of the particular problem, particular diseases, thus to prevent the handicapness. So that is we applied under tertiary prevention, that is disability limitation to reduce the occurrence of handicap in the future. So let us see what you mean by impairment, disability and handicap. Okay, so the disease, any disease may lead to impairment, and then it may lead to disability, and then it may lead to handicap. So impairment means any loss or abnormality of physiological, psychological or anatomical structure or functions. So impairment is nothing but it is any loss or abnormality of the psychological, physiological or anatomical structure or function of any organ or any structure. Then second one is disability. Disability means any restriction or lack of ability to perform an activity. So restriction or lack of ability to perform an activity in the manner or within the range considered normal for the human being. So normally human being can have some range of functioning, that has to be restricted. So he cannot function in that particular or regular range. So disability is nothing but it is, as you know, the term disability means no ability. So any restriction or lack of ability to perform an activity in the manner or within the range that is considered normal for the normal human being. So that is about the meaning of disability. So the last stage of disability is handicap. So handicap is a disadvantage for a given individual resulting from an impairment or disability that limit or that prevents the fulfillment of a role of a person in the community that is normal for the normal person, normal individual, that is depending upon his age, sex, social and cultural factors. So handicap is nothing but handicap is a disadvantage for a given individual resulting from an impairment or disability that limit or prevent the fulfillment of a role of an individual. So fulfilling the role of a particular individual in the community that is normal for that individual. So handicap will reduce the normal functioning of the individual, that is usually otherwise he has to perform in the normal way in the community according to his age, according to his sex, according to the social and cultural factors. So as we have already mentioned, disability means any disease that may lead to impairment, then that may lead to disability, and later it may become handicap if it is more complicated. Okay, so disease will be complicated in as impairment, disability and handicap. So that has to be limited. For that we have to make a disability limitation. We have to reduce the disability due to any particular problem in the course of tertiary prevention. The second specific intervention of the tertiary prevention is rehabilitation. That is nothing but bringing back to the normal stage as a normal person. Okay, that is nothing but bringing back to the normal stage of a particular client or particular person from a problem. So here we use the combined rehabilitation, the combined and coordinated use of medical rehabilitation, social rehabilitation, educational rehabilitation, vocational rehabilitation, etc. So the combined and coordinated use of medical, social, educational and vocational measures for training and retraining the individual with certain problems with a disability. So training and retraining of the individual to the highest possible of his attainment of the goal and attainment of the normal functions, to the highest possible level of his functional ability. Now we already said that the normal role of the person will be get reduced due to the disability and that is handicap. So here in rehabilitation we bring maximum highest possible level of functions of the person or individual in the community with certain rehabilitation programs such as the medical rehabilitation, vocational rehabilitation, social rehabilitation, psychological rehabilitations and etc. 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 So there are many forms of rehabilitation used to bring back to the person in a normal stage according to his disability. So that will be applied in the tertiary prevention under rehabilitation specific intervention. So in short, as a summary, today we have discussed about the levels of preventions. There are 4 levels of prevention, that is primordial prevention, primary, secondary and tertiary. Each prevention has got 2 specific interventions. Primordial prevention usually applied for the non-communicable disease prevention, and primary prevention usually applied for the communicable and non-communicable diseases. Primordial prevention, we have two specific intervention, that is individual education and mass education. Primary prevention, we have health promotion and specific protection as specific interventions. Then when primary prevention and primordial prevention failed during the pre-pathogenesis phase, we apply for the secondary prevention. That is a secondary prevention and tertiary prevention we applied in the pathogenesis stages of the disease. So secondary prevention has got two specific intervention, that is early detection and adequate treatment. When secondary prevention fails, we apply the final prevention, that is tertiary preventions. That includes two specific intervention, that is disability limitation and rehabilitation. So this is about the topic of levels of prevention. So thanks for watching. Hope this video really benefits in your studies and exams. If you feel it is really worth and benefit, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next and important academic video. Thank you.